The Teach Back Method for Patient Education. To read instructions on a medication bottle, patients need at least an intermediate level of health literacy. Unfortunately, that means about a third of Americans will struggle with medical instructions. For the remaining two-thirds, understanding and managing a healthcare plan can be a challenge. Helping patients take care of themselves after a hospitalization begins with helping them understand why they were admitted. A strategy we can use in the hospital setting to make sure patients understand their healthcare information is called the Teach Back method. Patients will be seen, tested, medicated, bandaged, or rehabbed in a short amount of time by several healthcare workers. On discharge day, each of their caregivers will have instructions for home. With the Teach Back method, patients are asked to repeat the instructions they received. The healthcare worker can assess the patient's understanding, then reteach or modify the teaching if it seems the patient doesn't quite understand. Teach Back shouldn't be complicated. Take a look at the patient's discharge plan and choose 2 or 3 topics that will be most important for your patient to understand. Help your patient lock in the information by providing something physical like the written AVS form or an easy to read handout. Acknowledging that you're giving a lot of information and that some of it might be hard to follow can help. Here is where Teach Back happens. Don't ask if they have questions. Ask them to tell you what they understood of what you just told them. If the patient doesn't quite have all the information correctly, you can easily provide clarification. Example questions include, I really gave you a lot of information about CHF. Can you tell me what you understand? Or, some of your medications have changed. We can review it one more time. This time, you tell me. Let's follow along now as we use TeachBack to see if a patient understands their new CHF diagnosis.
Hi Morgan, I'm Leanne. We're going to talk about your discharge information before we let you go today. Can you tell me why you were actually admitted to the hospital?
Congestive heart failure.
Did they explain to you what that means?
Yeah, my heart's not pumping well.
That's right. Now, we were able to get you fixed up nice and ready to go home. You'll follow up with your primary care provider and a cardiology consult. In the meantime, we gave you an idea of some symptoms that you need to be looking for and some medications that you're going to start. Can you tell me about the symptoms?
I need to watch for leg swelling, shortness of breath, and weight gain.
That's right. How much weight should be concerning for you?
I think it was 7 pounds.
Close. If you gain about 5 pounds in a week's time, we want to know about that. Or you can think about it more than 3 pounds in one day, then you'll give your doctor a call.
Okay.
Now, you were started on 2 new medications. Can you tell me about those?
I think it was metoprolol, and that's for my blood pressure and my heart rate.
Right.
And Lasix is also for my blood pressure.
How is the Lasix going to help you?
It's going to help get rid of the water on my body.
That's right. Good idea not to take it right before bedtime.
Okay.
I think you're going to do okay. And good luck to you, Morgan.
Thank you.
Your patient can benefit from hearing the plan more than once. Begin teaching at admission. Remember, use the Teach Back method to make sure everyone is comfortable with the plan.